Built 45 years ago and only refurbished once, the hospital serves over 20,600 people from Anikap, Beersheba, Fransfontein and Terrace Bay, many of whom travel over 200 kilometers to access health services. With a capacity of 121 beds, the hospital lacks sufficient and adequate beds and mattresses for patients, as well as delivery beds that need proper sheets. There are issues with water supply, proper flooring, and resuscitation tables for newborns, while ambulances are also non-functional or unavailable. The facility, which requires renovations for restrooms, more staff, basic health equipment, and emergency services, has put added pressure on the hospital staff.
According to the nurse-patient ratio, we don't have enough nurses. We don't have nurses. The staffing, when it comes to nurses, when it comes to doctors, currently we only have 3 doctors. One came recently. We were coping with 2 doctors. So the workload is too much and the pressure is too much with limited resources.
UNICEF country representative and the Japanese ambassador to Namibia have both expressed concern over the situation, describing it as distressing and uncomfortable for patients. They are assured to bring these issues to the attention of the Health Ministry and to offer support in any way possible.
When we support government programs, we agree on where to support. So we and the government, UNICEF and government, come up with a plan that identifies the needs. And then we plan with the health facilities, and then when the services are delivered, we also monitor. So we go to see, for example, like we are here. Here, this is an exploratory mission to find out what is the health facilities here and what can be done, because we also go into a new country program next year for the next 5 years. So this also gives us an opportunity, since we've seen. So when we are discussing with government and we don't see Khorixas, then we can remind government that what about Khorixas, for example. So
I cannot pledge anything today, but this tour is so much important because we have several steps forward to provide necessary aids, necessary support to Namibia. The first step is to recognize the situation. Second step is to discuss with our partners, and third step is to inform and ask the headquarters to provide the necessary support.
Hospital staff voiced their frustration regarding the procurement process, which hinders the facility's ability to obtain the necessary resources.